We're going to talk about how to record patient identification. So many of us have healthcare practices where we receive Alberta healthcare insurance payment for our health care services that we provide to our patients. We might have other insurance information as well, and we might have patients from other provinces. But how we record that information and to verify that patient information is correct is a critical part about providing good patient care to our patients. So I want to review some basic steps with you about how to record patient identification and make sure that we're taking responsibility for this very vital step about correctly identifying a patient identification. Welcome to Practice Management Nuggets Podcast. Practical practice management and privacy tips to help you start, grow, and improve your healthcare practice. If you are a clinic manager, team lead, healthcare provider, or practice owner, these practical tips will save you time and money. My name is Jean Eaton, your practice management mentor and your practical privacy coach with Information Managers. I help you manage the pink elephant in the room. Let's get started. Patients should be asked to show their Alberta Healthcare card and photo identification when visiting a practitioner's office. The practitioner will submit a claim to the Alberta Healthcare Insurance Plan directly for all insured services provided. If a provincial healthcare card is not shown or the individual is not eligible for the coverage, they may be asked to pay for health services before receiving them. This is an authorized use for custodians or healthcare providers to request the patients to provide their Alberta Healthcare insurance information to that healthcare provider for the purposes of receiving compensation for that service. Now, it's important to remember that the Alberta Healthcare card, or whichever insurance healthcare plan that you're with, is a protected information under our legislation. So under the Health Information Act, it's only those custodians who are going to use that billing information for the purposes of receiving compensation for the care and services of the patient can compel or request or require a patient to provide that information. A patient has the right to say no and not provide their Alberta healthcare information to anybody else who is not providing a healthcare service. So we have the legal authority under the Alberta Healthcare Act to be able to ask patients to provide their Alberta Healthcare card. Now, when patients are not correctly identified at the time that they are being provided a healthcare service, bad things can happen. This was done by a study from an organization called RAND in the US in 2012. They identified reported cases of medical errors, and they identified that medical errors started because patients were not correctly identified at the point of being able to provide that healthcare service. So these statistics are shocking. Because patients were not correctly identified, 27% of all of the reported cases had radiation errors, 29% medication errors, 5% the wrong patient on the wrong site for surgical procedures, 850 medical errors, and 20 deaths that followed blood transfusions when the patients were not correctly identified. And of course, we know on a regular basis, that when we don't properly identify patients, that we have privacy breaches and medical identity theft. And of course, we have to deal with the headache of having duplicate patient records. In Canada, we have a number of patient safety alerts and requirements under Accreditation Canada to make sure that we have correctly identified a patient prior to any care interaction. The importance of correct patient ID are obviously to be able to provide good patient care to our patients. Incorrectly identifying patients contributes to medication errors, transfusion errors, procedure and testing errors. Good documentation. We want to avoid incomplete, inaccurate, and duplicate patient records. When we have the correct patient ID at the healthcare provider, the family physician or GP, we are providing a gatekeeper service for those patients. So in order for them to have further access to healthcare services from other specialists, from other facilities, the GP is generally the person that starts that process. So it becomes really important that we get the correct patient identification at the time when they present to our healthcare practice. Now, every time that a healthcare provider is providing service to the patient, they should be taking the additional responsibility of verifying the individual against two pieces of patient identification data types. When the patient is receiving a blood transfusion or perhaps going to surgery, they may not be actually showing the surgeon their Alberta Healthcare card and their photo ID. They're doing that at the registration point of care. So the surgeon is relying on the registration process to make sure that we have properly and correctly identified the patient identification. We are the gatekeeper to that healthcare service, and we have a very important responsibility and role to be able to do this right. And of course, to be able to provide a healthcare service, we want to be compensated the billing for that interaction. When you have the correct patient information to provide for that encounter information, you're going to have far fewer billing rejections. And that makes all of our lives easy. When you have the patient in front of you is the ideal time to be able to confirm and verify the identification of that patient so that your billing process is smooth. If the billing information for the patient is not the same as what the patient shows you at the time of registration, the best time to get that corrected is when the patient is right there. Instead of playing telephone tag with the patient to say, we seem to have a problem with matching your address or date of birth or a different name, and your billing has been rejected. Please come back or call the clinic to get this straightened out. Well, we know the chances of the patient doing that are probably not so good. And it's far easier to be able to manage that when the patient is standing in front of you. So let's take a look about the steps that we can do to make this process easier. In Alberta, the healthcare insurance card issued by the government of Alberta is not a high security card. In fact, it is a pretty simple paper card with limited patient information. Now, other provinces like Ontario have a much more secure card. They have photo ID and they have anti-theft holographic images and other wonderful things. Well, we don't have that in Alberta, so we need to take those additional steps to make sure that when a patient comes to the clinic, that they're providing the Alberta Healthcare card and the photo ID. So this is something that we need to make sure that our patients understand, that we're asking them for their photo ID and the Alberta Healthcare card so that we are properly identifying them for the appropriate healthcare services. So accreditation requires us to register patients and correctly identify the patients before we provide a health service. But it also requires us to be able to provide education to the patients to make sure that they understand the importance of having their healthcare information verified and making sure that it's accurate. It's important to them because they want to have the right services and to be able to have the right medications. When we prompt and train our patients to make sure that the healthcare provider is asking for the verification of their identity before they're provided a health service, then patients will actually help to keep us making sure that we're not missing or skipping on any of these steps. So the patients will help us to identify, oh, do you need to see my photo ID too? Now, if this is a new practice in your healthcare practice about getting the photo ID and the Alberta Healthcare card, expect a lot of questions. But that's a good thing. It helps us to make sure that we're doing the job right and we make sure that we're providing that education to the patient. We also know that if you're referring that patient to a lab, for example, to have test results done, that the lab is also going to ask for photo ID. So if we can train the patient at the beginning point, at the time of the registration, then the patient is going to be better prepared at each of their other steps in that healthcare process. So when you have a patient coming to the office, you have asked them for their Alberta Healthcare Insurance card. You'll ask them for the photo ID. You'll ask them for information from the patient. Now, they may tell you that verbally. I also like to use a new patient registration form so that they might be actually writing down some of this information. And we'll come back to that in just a minute. Now, you may also have information in the existing patient EMR. Now, even if you have a new patient coming to your clinic, the patient may say that I've never been to this clinic before, but they might have already previously identified that your physician is their physician of record. Maybe they know the physician because their spouse comes to this clinic. And when the patient goes to the hospital emergency room and they're asked for the family ID, they say, oh, it's Dr. ABC because that's my spouse's a family physician. So even if the patient doesn't know if they've been to your clinic before, or perhaps they've forgotten, there may still be patient information in your EMR system or your patient demographic system if you're not using an EMR. So you're going to take a look at all of these sources of information to verify the identity of the patient. So you're going to ensure that the name matches in all of those 4 data sets. Now, this is not an easy process. There's always alias names, married names, divorce names, abbreviations. So I've got a procedure listing that's going to help you to identify the process recommended strategy from Alberta Health Services to properly identify the patient registration. So look for that information in the members portal or in the show notes here. You're also going to compare the date of birth across all 4 data sets. Now, the Alberta Healthcare card will have the insurance number, and so hopefully will the patient, and it might already be in your EMR system. You're going to confirm the address between what the patient tells you and on the photo ID. So ideally, we want to have government-issued photo ID, like a driver's license, but use whatever is available to the patient. This isn't a process to make it overly onerous for the patient. The process is to be able to correctly identify the individual. So ask for the driver's ID if they have that. Ask for their library card if that's all they've got. You're also going to compare the image on the photo ID to the person that's standing in front of you, and they should look reasonably the same. When you have all of the patient identification clear, you're going to document that you've asked for the photo ID and that you've verified the information. You're also going to then record the information in the EMR system. Then you can verify the information on NetCare. So in Alberta, we have the opportunity to look up the information on NetCare through the EMR, through the parameter-launched browser of an EMR that supports that. Or you can look on the NetCare website with your secure fob so that you can have secure access. Or you might phone the NetCare hotline number to verify that the Alberta Healthcare number, the date of service, and the date of birth are valid at the time that the patient is in front of you. So you're going to take a look at the data sources, Alberta Healthcare card, the photo ID, the patient who's standing in front of you, or perhaps the registration form, and your EMR. Then you're going to verify the information against NetCare or that billing data source. So you need to make sure that you have appropriate policies and procedures so that you are doing this on a consistent basis. It's critically important that when you are registering patients, that everyone within your organization is using the same data elements and data definitions about registering the patient's name. So if you have patients with multiple names, if they have abbreviations in their name, if they are Saint Smith or Von Smith, how are you going to record that in your database? I like to use a new patient registration form, and that information is in your membership, so you can download a sample and you can modify it for your needs. On the form itself, there is the part of the form that the patient fills out, and then at the bottom is the part that the clinic completes. On the part that the clinic completes, I have a checkbox to say that the person who did the registration verified the identification of the patient against photo ID. Remember that you can ask the patient's questions. You're going to ask for the ID and document that you've done that. Then you're going to enter the demographics into the EMR, And then you're going to use that parameter launch browser in Netcare to be able to look up that patient's information in Netcare. So make sure that you get the healthcare number correct in the EMR first, then look up that patient's information in Netcare. So if there is a typographical error between the time that you entered the information in the EMR and you can't find that patient in Netcare, that's going to be your flag to say that there probably is an error in the typing. So then you can make that correction right away. You will also verify the billing information in the Netcare using that hotline phone number if that's the way that you need to be able to do that. Now, don't photocopy the ID. The driver's license is something that is provided to you by the patient so that you can verify the image. It's not provided to you so that you can provide a health service. So if it's not required for providing a health service, that's more information than you need to be able to collect. And in fact, you don't have the legal authority to collect the driver's license number or photocopying the card itself. So don't write down the driver's license number. Don't photocopy the driver's license card. You don't have the legal authority to collect that information. And once it's in your EMR system or your paper record, you're responsible for everything that you collect. So if somebody takes access to the photocopied card for your driver's license number and then uses it inappropriately, perhaps for identity theft, then the person that collected the information in the first place is responsible for it. And if you collected it without having the proper legal authority, then that's in a bad place that you don't want to be. Now, some people ask me if you can photocopy the Alberta Healthcare card. I don't recommend this process. If you've done the proper steps at the front end to make sure that you're not transposing the digits, that you're confirming with Netcare that that information is valid at the time that you provide the service, then you really don't need the Alberta Healthcare card. Remember, if you do choose to photocopy that Alberta Healthcare card, that you need to demonstrate that you have appropriate and additional safeguards in place to make sure that somebody doesn't download that photocopied card and use it for some other process. Now, we've already identified that the Alberta Healthcare card is just a simple piece of paper. So if you're scanning that information, then it would be easy for somebody to print that out, cut it to size, and then use that to be able to access healthcare services. So if you're going to photocopy the Alberta Healthcare card, you need to make sure that you've got some additional safeguards in place to prevent it from being used for an unauthorized process. You can avoid the situation entirely by not photocopying the photo ID, not photocopying the Alberta Healthcare card, and making sure that you've properly identified the billing information at the front end. I hope that this information helps you about how to correctly identify the patient at the time that you're providing services, and that means for you when you're registering the patient. I'm happy to help you to identify a good process for your clinic to correctly identify patients so that you can provide continued good care for your patients. Did you hear something on today's podcast that you would like to go back and listen to again? Or maybe you heard something on one of our previous podcasts, but you don't remember which one, and you'd like to be able to find it quickly and easily. Well, that's easy to do now. If you heard something on this podcast that you want to revisit, go to practicemanagementnuggets.live/search and enter the keyword in the magic box. You will be brought back to the podcast at the exact spot where we talked about it. This video keyword search tool uses the new Searchy app. If you would like to know more about this, visit informationmanagers.ca/likes-searchy. That's SEARCHIE. I'm excited about this new season, and I'd so appreciate your help to spread the word with your colleagues. First, make sure that you subscribe and add a review on whatever podcast platform that you use. Next, take a screenshot of this episode that you're listening to right now and share it on your Facebook, Twitter, LinkedIn, or your preferred social media channel. Remember to tag me and I will reshare your post. When you share the show, it makes it easier for people just like you and who like what you like to find the show. Until next time, this is Jean Eaton, your practice management mentor and your practical privacy coach.